a 7-month-old baby. Strange, growing bumps that no doctor could explain, and parents watching their infant get worse by the day, with zero answers. This is the story of one family's terrifying medical mystery, and what finally happened when they refused to stop pushing for help. Let's set the scene. A young couple in the Netherlands has a healthy 7-month-old baby boy. By all accounts, he's a normal, thriving infant, 8.5 kilograms, never traveled outside the country, growing up in a home with a cat and a dog. The kind of ordinary, happy family picture you'd find on anyone's phone. Then, one night, everything shifts. Their son falls seriously ill. He's running a fever, clearly miserable, and the parents do what any concerned parent would do. They take him to the hospital. The diagnosis comes back as a double ear infection, which is painful and scary, but ultimately very treatable. He's admitted for observation, given a course of amoxicillin, and the family settles in, expecting a straightforward recovery. But 2 days into that hospital stay, something unexpected appears. Small, strange spots on his hands, on his feet, on his legs, and nobody, not the nurses, not the attending doctors, can immediately explain them. At this point, the stakes feel manageable. Spots in a sick baby aren't always alarming. Sometimes illness brings rashes. Sometimes antibiotics cause reactions. The parents are worried, but they're told to monitor things. They go home and they watch, and they wait. But the spots don't fade. They don't behave the way a normal rash would. Instead, they harden, they scar. They leave marks on this tiny boy's skin like little craters. And then about 3 weeks after those first spots appeared, something new shows up, something bigger. 1 week before the family reaches out for help online, a new bump appears on their son's leg. It starts the same way the original spots did, small, raised, unremarkable at first glance. But this one doesn't stay small. It grows, and it keeps growing, and it is nothing like what came before. This isn't a flat spot or a scab. This is a raised, soft lump, visibly larger than the scars left by the earlier spots. The parents photograph it. They study it. They try to connect it to everything they know. The ear infection, the amoxicillin, the hospital stay, the pets at home, the fact that no one else in the family is affected. Nothing adds up. So they go back to their family doctor. The GP examines the bump, looks at the photos, looks at the scars, and delivers a phrase that no parent ever wants to hear from a medical professional: "I don't know what this is." They get a referral to a dermatologist. Surely a skin specialist will have answers. The dermatologist examines the boy carefully, and then, again. "I don't know what this is." 2 doctors, 0 answers. A growing bump on a 7-month-old's leg. The parents are told to try fusidic acid ointment and Bactroban, both topical antibiotics. They apply them faithfully. Nothing changes. The bump doesn't shrink, it doesn't respond. It just sits there, soft and strange, getting bigger. A biopsy is ordered. This is a significant step. Taking a tissue sample from a baby requires care and precision, and it tells you that the medical team has moved beyond guessing and into investigating. During the biopsy procedure, something notable happens, or rather, something notable doesn't happen. There's no pus. In many skin infections, when you open a bump, you find pus. That tells you there's a bacterial infection trapped inside, building pressure. But here, nothing like that. Just soft tissue, healthy-looking tissue that has, for some unknown reason, formed this mysterious lump. The sample goes off to the lab. The family waits. It is at this point that the parents turn to the internet. Not out of desperation, exactly. They're still in the system, still waiting for biopsy results, but out of the very human need to feel like they're doing something. They post their story and their photos to a medical community online, describing everything in careful detail. Their son's age and weight, the timeline of events, the hospital stay, the ear infection, the amoxicillin, the spots that became scars, the bump that won't stop growing, the pets, the fact that no one else in the household is affected, the fact that they've never left the Netherlands. They are thorough, methodical, clearly intelligent people who are scared and doing their absolute best. The community responds with theories. Hand, foot, and mouth disease, which was actually the family's first guess too, gets mentioned. Atypical bacterial infections, reactions to medication, fungal infections, cat scratch disease, given that there's a cat in the home. Nobody has a definitive answer, because nobody can have one without actually examining the child and running proper tests. but the conversation is happening, and people are paying attention, and the family feels slightly less alone in their confusion. And then things get worse. The bumps start multiplying, new spots appear, the original bump continues to grow. The family makes the decision to go back, not to a regular appointment, not to a scheduled follow-up, but to the emergency room. This is the turning point. This is the moment where the parents stop accepting uncertainty and start demanding urgency. And it works. At the emergency room, the response is completely different. The medical team takes comprehensive samples, a throat swab, a swab from the fluid inside the bump itself, and a significant blood draw. They are building a full picture. The initial blood results come back, and here is something genuinely surprising. They're normal. No elevated inflammation markers, which you'd expect to see if there were a systemic bacterial infection raging through his body. No signs of reduced immunity or low blood count. On paper, this child looks fine, and yet he clearly isn't. The bumps are real. The scars are real. The growth is real. Based on the clinical picture and possibly early culture results, the medical team starts the baby on azithromycin. This is significant because azithromycin is not your standard first-line antibiotic. It's used for specific bacterial infections, including atypical organisms that don't respond to the more common drugs. It's used for Bordetella, for certain mycoplasma infections, and notably, it is one of the treatments used for Bartonella henselae, the bacterium responsible for cat scratch disease. Given that this family has a cat, and given the appearance and location of these soft, growing nodules, cat scratch disease would be high on many clinicians' lists. But this is speculation. The family is still waiting for confirmed results. What isn't speculation is what happens next in terms of the system around them. They're told they'll sit down with a pediatrician to go over all the results. They're told that if things haven't improved or if clarity hasn't been reached, they'll be referred to a specialized children's hospital. They're given direct access to call the pediatric ward at any time if their son's condition changes. For the first time since this started, the family feels like the full weight of the medical system is finally behind them. So, what can we take from this story? Because beyond the medical mystery, which is gripping and unresolved and deeply human, there are real lessons here for any parent or anyone navigating a confusing health situation for someone they love. First, trust your instincts and document everything. This family photographed the bumps, they tracked the timeline, they noted every medication, every symptom, every detail about their environment and their child's history. That information is what allowed doctors to eventually start connecting dots. When you walk into a medical appointment with clear, organized information, you become a partner in the diagnosis, not just a bystander. Second, a doctor saying, "I don't know," is not the end of the road. It's permission to keep going. Two specialists couldn't identify what was happening. That didn't mean nothing was wrong. It meant the case was complex and needed more investigation. These parents didn't accept uncertainty as a final answer. They kept pushing. They went to the emergency room when things escalated, and that decision is what unlocked the more comprehensive testing and the treatment that finally began. Third, when symptoms escalate your response. The ER visit happened because things got worse. Some people wait, hoping things will improve on their own. Sometimes waiting is right. But when a 7-month-old's undiagnosed skin condition is spreading and growing, the emergency room is exactly the right call. You are never overreacting when it comes to your child's health. And fourth, and this is quiet but important, online communities used carefully can be a source of support and information that helps you stay sane while the medical system works. This family didn't replace their doctors with internet strangers. They used the community to feel less alone, to gather possibilities, and to stay engaged while waiting for answers. If this has ever happened to you, if you've sat in a waiting room with a sick child and no answers, if you've been told by a doctor that they simply don't know, if you've watched something get worse while feeling powerless, you already know how terrifying that experience is. You are not alone. And the way through is exactly what this family did. Document, persist, escalate when you need to, and never stop advocating for the person who can't advocate for themselves. If stories like this one matter to you, real cases, real families, real health questions that don't have easy answers. Hit subscribe. New videos go up regularly, and every single one is made for people who want to understand what's actually happening in their bodies and the bodies of the people they love. We'll see you in the next one.